Hi, everyone. My name is Casey Oren. I am the Director of Orientation, and I am joined here by my colleagues here at JMU who are excited to give you lots of information and resources to support your student during this transition and throughout their time here at JMU. And so we'll be spending the next 45 minutes. It'll be interactive, so we'll ask for a little bit of your involvement in this process as well. I have activated the chat function of this webinar, and so if you will toggle over kind of the functions that may be at the bottom of your screen, you can find the chat. I'll let you know when we want to use the chat, but just so that you're familiar with it. And then toward the end of our time together, we will use the Q&A function as well. So that is down at the bottom near the chat function. That's where you can submit your answers as we get to submit your questions as we get to the end of our time together today. So without further ado, I am going to ask my colleagues to introduce themselves and let us know who's with us. And so if we will start with the Counseling Center, I'm going to turn it over to you, Paul.
Good afternoon. My name is Paul Poto. I'm a staff psychologist at JMU's Counseling Center. A little bit about the center. It offers free, confidential, personal counseling and psychiatric services to JMU students. If students are interested in accessing services, we have walk-in hours Monday through Friday from 10 a.m. until 3 p.m. During that first appointment, they'll meet with a provider to discuss what options might make the most sense for them based on the suite of services that we have. Our services include individual and group counseling services, 24/7 crisis services, access to consultation, case management, psychiatric services, specialized treatment programs, and self-care spaces. Good to be with you all.
Hi, everyone. My name is Dominique Rodriguez. I'm the Assistant Dean of Students, and I work in the Dean of Students office. Our office does a wide variety of things, so I'll just mention a few right now. The first one I'll talk about is our Madison Cares program. This is a referral program that anybody can refer a student to, including yourself. So if there's any reason that you might be concerned about your student or maybe even a friend of your student that goes to JMU, you can submit a Madison Cares referral to let us know about your concern. And that could be academically related. It could be about adjusting to college. It could be about mental health, anything you think of. And we will reach out to the student, make sure they're getting the care and resources that they need, and also just serve as an advocate for them on our campus. The other program I'll mention is Rebound. This is a program that is normalizing setbacks and obstacles that all of us face in our lives. And this program will set your student up with a mentor that they can meet with one-on-one for 8 weeks to set and reach any goals that they have related to any area of wellness that they want to focus on. And then the other service I will mention is contacting faculty on behalf of your student. We call them professor notifications. And this is a service that we use when students have to be out of class for an extended period of time. So the example I'll use is, say your student has to have surgery and they need to be out because they have to have their leg elevated for a week and they can't go to class. We can inform their faculty members about what is going on so that they know that this is what is happening for your student, and then they will have to work with their faculty member to determine what to do next. We cannot excuse absences. This is just a kind of courtesy informational email, but it's usually very helpful. So it's just one email being sent rather than 5 separate ones that your student has to do. But great, thank y'all for being here, and we'll talk a little bit more later.
Good afternoon, everyone. My name is Brittany Diozegy, and I'm one of the assistant directors in the Office of Disability Services. Disability Services is located on the first floor of the Student Success Center, and we are the department that helps students with disabilities who need specific accommodations for accessibility reasons. We have programs for sending information to faculty, accessible media and assistive technologies, interpreters and captioning, and an academic coaching program for all JMU students called Learning Strategies Instruction, or LSI. Additionally, if your student has already submitted an application to our office and is waiting to hear about next steps, please know that we have received more applications for services this year than ever before, and we are processing as quickly as we can. If your student would like an update regarding the status of their application, please contact our office.
Good afternoon. I am Betsy Gentry. I'm the Associate Director of Nursing here at the Health Center. We are located in the Student Success Center on the 1st and 2nd floors, and we provide a variety of services for students, health services for students. Our clinics include general medicine, GYN, urgent care, and our nurse allergy clinic. And some of our services include general medical care, injury and illness, immunizations, allergy injections, lab and nutrition services, along with on-site x-ray. A complete list of our services is listed on our website, so I would encourage you to peruse that. We are here to serve the students with a goal to help them be well, stay well, and do well.
All right, great. Thank you for sharing all those resources, at least a little preview of what is to come and what we'll talk further about. So next, I'm going to talk a little bit about how we're going to structure this time and what we call is calls from campus. And so first, we'll have one of our orientation leaders who are going to read one of the 8 scenarios that may be a phone call that you may receive during your student's first year. And then we're going to ask for you in that chat function at the bottom to put in how you as a parent or guardian may respond to this phone call if your student was calling you. And so we asked, I'm looking for 2 different types of responses. And so, but I'm hopeful that knowing that we have over 70 attendees today, that we'll get many more than just the 2. And so I'll read 2 of those out loud before turning it over to our campus experts that will confirm those responses or provide any other further clarity as we go through these. To kick us off, Alex, if you want to take us through that first phone call.
Hey, Mom. I know in Richmond I see Diane and would like to keep seeing her, but there's also a counseling center here at JMU. Do you think it'd be better to continue to see Diane over Zoom or work with someone on campus?
All right, so at this time, we are looking for 2 responses of how you would respond to your student if you receive this phone call. And again, you can just put those in the chat. All right, great. Thank you for participating. This is awesome. So the 2 that I see is, since Diane already knows your history, the recommendation would be I would stick with her. I see another one of what do you think is the best recommendation? Let's see if I see anything different in here. Here's one. I would continue to see your current counselor, but go and meet with someone locally and see if you have success and then make a decision from there. So let's hear from our campus experts, the counseling center. Paul, do you want to tell us more?
Sure. Yeah, lots of great feedback, ideas, and answers there in the chat. So because the demand for services on a college campus is always going to exceed the amount of clinical hours that we'd be able to provide 21,000 students, our center operates off what's called a short-term treatment model, meaning that most students that we meet with for individual therapy might be here for a range of 3 to maybe 6 or 7 appointments. Beyond that, if it's determined between a student and a clinician that longer-term services might best serve their needs, then we work with students to find out what the best option for longer-term treatment might be. We have some outstanding case managers and other resources that can help students navigate providers in the community. And also a benefit of telehealth is that in the Commonwealth of Virginia, a student could work with a telehealth provider that's located anywhere else in the state, be that Virginia Beach, Richmond, Northern Virginia. One final plug for that is that some of you may have seen that JMU is partnering with a company called Timely Care that will be able to offer all students up to 12 individual telehealth therapy appointments. And you should see more information coming out about that as the fall semester gets closer.
Great, thanks, Paul. All right, let's move on to scenario 2. Alex?
Hey, Mom. Do you know if at JMU my extra time on tests will be the same as it was in high school?
All right, so again, at this time, if you could type your response in the chat box, how you would respond to your student if you get this phone call home. Right, great. So a few of the things that we're seeing is to check with your advisor. Also, I would talk to the Office of Disabilities and see what they would say. Check with your professor. Another, ask your student to contact the disability office. And I really love how that says to ask your student to contact the disability office.
Great responses, yes. And the answer would be that to get extra time on exams and quizzes due to a disability, students will need to go to our website, Disability Services website, and complete our application, upload their supporting documentation of their disability, and submit it to us. That way we can go in and review it to determine their eligibility and then meet with them to orient them to using accommodations at JMU. Then we will send accommodation letters to their professors to notify them of the accommodations that need to be implemented in their course. And students who had accommodations in high school may find that a primary difference to using accommodations in college is that they are now responsible for communicating directly with their professors and our office to use the accommodations after the accommodation letter has been sent.
All right, great. Thank you, Brittany. All right, let's move on to scenario 3. Alex?
Hey, I'm super sick. I felt awful all week. What should I do?
All right, families, let's hear your responses. Let's see them in the chat. At the bottom of your screen, you can put in your responses to how you would counsel your student if you got this phone call. Lots of healthcare. Go to the healthcare center, University Health Center. Have the student call the health center depending on what the time of day and night for this call that it might come in. All right, Betsy, you want to tell us more?
Sure. So those are definitely good options. Just remember that many illnesses are self-limiting and can be treated with self-care measures. So we really focus on that for our students. As most of you are aware, over-the-counter medications a lot of time will at least get a start on an illness like this until they can seek medical care or unless it gets worse. We do have an entire list of self-care guidelines on our website for the most common illnesses. That's on our website and for the students to review, but I would also encourage you to become familiar with that. So because they probably are going to call you before they call the health center. There is no charge to be seen at the health center. The visit is free, just nominal charges for lab work and some procedures. So if they become sick after hours, they can go ahead and start these over-the-counter medicines, send those with them ahead of time. If they don't have them, and our pharmacy has some over-the-counter medications at a very reasonable price. But if it happens on the weekend or outside of our office hours, they can go ahead and start these over-the-counter medicines. They can schedule online for the next available appointment. They can call when we're open, or they can also call during business hours to speak to a nurse to explain their symptoms, when they started, and the nurse will help navigate what the best course of action for them will be.
All right, great, thank you. All right, let's move on to scenario 4. Alex?
Hey, Dad. I'm feeling unsafe in my dorm right now, and every time I leave the room and take the shower or fill my water bottle, this person in my hall makes me feel super uncomfortable, and I have no idea what to do.
All right, so families, if you want to put your responses to your student in the chat. All right, seeing lots of suggestions to talk to the RA, the resident advisor that's in residence life in their residence hall. Some questions about, can you tell me more about why they are making you uncomfortable? And communicating with the RA again. All right, these are all great first steps. And so let's turn it over to our campus partner, Dean of Students.
Great, all great and accurate responses. I love the ones where you're asking for more details. I would absolutely recommend that you do that. It's like, what is making you uncomfortable? Is there something specific that this person is doing? And the first thing we would advise you to do is see if there's any sort of safety issue that is happening. Likely it is not, and I don't think it would be maybe in this situation, but if there's for some reason a safety concern is happening, then we need to call campus police. Then absolutely your student should do that. But if that is not the case and it's maybe less severe than that, the Dean of Students office is a great resource that would like to be involved in every kind of area of this situation. So we would be more than happy to talk to you if you would like to call us and tell us about the concerns your student is having. We would want your student to come to us. We will ask if they have talked to their RA, maybe even their hall director, who is the supervisor of the RA and also lives in the building, and see if they're aware of the situation. We work very, very closely with our colleagues in the Office of Residence Life. So this will likely be a approach that we will work together with, but maybe this other student also needs help too. So we'd like to get in contact with them, see if they're okay. Is there something serious going on with them? Do we need to contact their family or emergency contact to see what's going on? But we would be able to be involved in every point of the situation. So we want to help you, we want to help your student, and we want to maybe help this other student and what they're going through as well. So you can do this by calling our office. Your student can come by. We're on the 3rd floor of the Student Success Center. Or you can submit a Madison Cares referral online. So you can do this, or your student can do this for themselves, or maybe even this other student. But yes, all of your answers are absolutely accurate, but we would be very happy to help in this situation.
All right, thank you, Dom. All right, let's move on to scenario 5. Alex?
Hey, I know I haven't been taking it, but my Zoloft prescription has expired and I think it might help. What should I do?
All right, parents and guardians, if you want to enter those responses in the chat. All right, we've got a here, so let's reach out to renew the script, the prescription, and call your doctor to talk to them about it and see what options there are. Can you talk about why you haven't been taking it? Would it be helpful to talk to someone on campus? All right, let's turn it over to our campus partner to tell us more.
So additional great answers from folks there in the chat. In order to ensure the well-being, success, and health of students on campus, our general recommendation is that they continue with any sort of treatment as prescribed coming into college. So in some cases, that might look like students that are engaged in weekly or monthly therapy prior to coming to JMU. Our recommendation would be that they continue that with their provider. Likewise, if a student has a medication regimen that they've been keeping up with, our recommendation would be to continue with that when they come to JMU until they have a chance to be reassessed by that provider. The counseling center does have 2 psychiatric providers that have the ability to provide prescriptions for students. However, due to demand for services, they're only able to work with students that are in ongoing counseling with providers, with therapists at the counseling center. So in the case of this scenario, we would likely recommend that they get in contact with the prescribing physician back home to negotiate that. Likewise, we might collaborate with our other campus partners. And so I'll pass things over to Betsy to talk more about how they might play a role in this as well.
Yeah, y'all have some great answers and thoughts there. Generally speaking, the health center does not prescribe ongoing medications for things like Zoloft or long-term care treatments. We are an acute care facility. And we do recommend that they try to reach out to their provider at home first to determine what the best course of action is. However, we do know that this is going to happen. Students are going to run out of their medication. So if that happens, they can make an appointment with one of our providers at the health center who can see them, discuss the options with them, and also potentially write a prescription for a short-term treatment of the medication that they need until they can get things straightened out with their providers at home. We do have a pharmacy. It does have a limited formulary, so it doesn't have a large variety of medications. There are no scheduled medications, no ADHD meds, no narcotics, that type of thing. And like the health center, it does not bill insurance, so there are nominal charges for the medication. So you kind of have to weigh that option. But you can look at our website to see all of the medications that our pharmacy does carry.
Great, thank you both. All right, let's move on to the next scenario. Anna, can you help us out?
Hey, Dad. I'm so worried. I just took my first exam and thought I had it in the bag. It went horribly, and I'm losing hope in my academic abilities. So I know I said I had my ADHD under control and didn't need the test to help I had in high school. But now I'm panicked and not sure what to do.
All right, families, let's see your responses to this call home in the chat. All right, so I see a couple that are mentioning to talk to the Office of Disability Services. One, have you shared your concern with your professor? Talk to the group that provides accommodations about steps to take. Yes. I like this one. Let them vent, try to encourage to see if they can feel better. If not, then ask about the medicine, study groups, and other forms of help. All right, so let's turn it over to our campus partner.
Yeah, great responses. And, those gems about not panicking and taking a moment and just letting them vent are really key. The first exam is often sometimes when reality hits for many students and they're learning the differences between their experience taking exams before college and now during college, or community college versus four-year institution. So we really recommend the use of a program for academic coaching that is provided for free here at JMU. This program is called Learning Strategies Instruction, and it's a great resource for all JMU students to get one-on-one support for building study skills and test-taking skills. Additionally, if your student does want to seek formal disability accommodations after this experience with their first exam, they can submit our disability services application online and upload their documentation so that we can review it and meet with them with hopes to get accommodations in place before the next round of exams.
Great, thank you, Brittany. All right, next one, scenario 7. Anna, can you help us out?
Hey, Mom. I really have been struggling since Grandpa passed away. I just want to be with family, and it's hard for me to be here. I've been missing class, have no energy for my schoolwork, and just want to be home. I think I'll come back to JMU after working through this.
All right, families, let's see your responses down in the chat. All right, so some of the responses is, okay, whatever you feel is best. Let's talk together with the help of the counseling center and see how we can work through this. One says I would have them come home for the weekend, family time, talk through it, and then hopefully they will be ready to go back after a weekend away. Try to talk to the student during that time, but encourage them to visit the counseling center to seek additional support. All right, let's turn it over to our campus partner.
So the Dean of Students Office works with students all the time who might experience a loss in their family or in their friends group, whatever happens. A lot of us know that this is kind of a reality of life, that we're going to lose people. And I think it can be particularly challenging as your student is making this transition to JMU. And if it's happening all at the same time, that's just a lot of layers there, maybe a lot of pain, and a lot of things going on. So if this is happening and you're not sure where to start, counseling center I think is a great option, but there might be multiple things going on here too. So I would really encourage you to have your student reach out to our office or have you reach out to our office and explain the situation. And we'd ideally just get everybody to talk. We always talk to students and we can include you in the conversation too if they're comfortable with that. I do that all the time with students in my office, and then we call their parents or whoever they want involved and just kind of talk through what's going on. So they experience this loss. Are we at a point in this semester where they're not functioning? Do they really need to go home and get the care that they need and they just can't be a student right now? And we can talk about what that process is with leaving JMU for the time being. Are they kind of coming around? Do we need to maybe inform the professors of what's going on? Our office can do that. The student has experienced a loss. This is what's been going on. Maybe they need to leave to go to funeral services, and we will let the professors know that as well. And maybe it does involve referring them to counseling as well, which we can do that too. We're on the same floor as the counseling center. So if your student's physically here, we can sometimes walk them over if they're open and get them in for an appointment. So multiple kind of things going on here, but this is definitely a situation that we work with. It feels like on almost a weekly or at least several times a month basis, because there's so many students experiencing similar situations like this. So please contact us if your student's experiencing this or your family is experiencing this, and we can try to help in any way that we can.
Great, thanks, Tom. All right, scenario 8. Anna, can you help us out?
Hey, I've been going to counseling on campus for a while. They just referred me to someone off campus. I'm not sure about this because I feel like the therapist at JMU and starting with someone seems like a lot. I think I need to keep seeing someone, but I'm not sure this is right.
All right, families, how would you respond to your student if they're calling home with this scenario? All right, seeing some responses to talk to your current counselor and see how they would suggest moving forward. Give it a try, and we can try to set up a telemed with someone at home. Another kind of give it a try. Even though you've had success with the on-campus therapist, they may have limited hours, and would encourage the student to at least try the off-campus option, especially if the on-campus option may be limited. It's a great response as well. All right, let's turn it over to the campus partner.
So again, to reiterate the short-term nature of the work that we're able to do through the counseling center on campus, the national data shows that most students are able to achieve change that they're looking for within that short-term range, whether that be 3 to 6 or 7 appointments. If that's not the case, we might work with the students to collaborate with an off-campus provider that can provide ongoing or longer term care to them. Building a new relationship with a new therapist is no different than meeting anybody else or starting a relationship with anyone else for that matter. And students can often get anxious about that. So trying to focus on supporting them to give that a fair try. Normally when I work with students or case managers work with students, they ask them to look online to see the provider's profile and find someone that you think would be a good fit for what they're looking for. And then again, to echo what some of what's been said with the health center, encouraging students to advocate for themselves. Have they asked this therapist for what they're looking for? Have they identified goals of what they want to get out of the experience? And so the more that parents and caregivers can support students advocating for themselves in that manner, I think the smoother the transition will be for those that are interested in longer care services off campus, if that's the case.
Yeah, thank you for that. So one thing that I do want to point out, we did get through all 8 of our scenarios, but in addition to it, as students have, gotten to this point, they have excelled academically to be able to join our community here in August. That journey to get here, they may have established, it may have taken multiple years to establish the best plan for them. And so during this transition, it's such a large transition that we want to reiterate that whatever they have found to help them succeed as they were transitioning through high school and figuring out what worked best for them is to continue doing those things that work for them as they then transition. There are a lot of other new things during this time. And so we want to encourage that consistency as they take on this new journey in this transition as well. I appreciate everyone's great answers and involvement in the chat. I'm very excited for these students to have you to call upon during their first year and beyond. And so at this time, I am going to ask the campus partners if there's one thing that you want families to know about your department. This is the time to share it. And then shortly after that, I will open it up to questions from you all in the Q&A. So if you all want to be thinking about those and putting those in the Q&A box at the bottom of your screen, we'll be able to answer some of those live here today. So to kick us off with that one thing you want families to know from your department, Paul, do you want to help us out with the Counseling Center?
Sure. So one more thing to leave folks with is that the Counseling Center offers what are called Counseling Connections appointments. These are consultation appointments that range between 20 or 30 minutes that are available for parents, caregivers, and/or students. And the purpose of these is to have a brief discussion about what might make the most sense for your student when they transition to JMU, as well as supports, resources, and services to help them make that connection. You can do that by calling the Counseling Center number, which you can find online or on our website, and set up that, again, brief 20, 30-minute consultation. And another plug will be for that timely care service that I mentioned at the beginning of today's webinar. So keep your eye out and encourage your student to keep their eye out for an email about how to set up that, which should be rolling out in the fall.
All right, so in terms of the Dean of Students office, you could probably tell by the scenarios I was responding to that our office works with students and families and faculty and staff in such a variety of ways. So if you're not sure where to start with a concern that you're having for your student or a situation that's going on, you are more than welcome to start with us. So that can be through calling our office or submitting a Madison Cares referral for your student. But please contact us sooner rather than later if you're starting to have some sort of inkling that something is off with your student. We want to know as soon as possible so that we can help them as early on as we can, and we can hopefully get to them sooner before things kind of get out of hand. Even if that does happen, we are still here, but please reach out to us. We are happy to talk with you all as family members. And also, we of course want to meet with your student as well. But we're very accepting of families calling us with any sort of concern they're having for their student.
And with regard to disability services, your student has a key role in making their need for accommodations known to our office themselves. And this building report early on can encourage them to continue to be comfortable throughout their semesters at JMU so that they can come back to us with any other questions or concerns that they have throughout their semesters. Additionally, there's not a list of accommodations for any particular diagnosis, and decisions about what accommodations are provided to an individual student depend on that student's documented needs and their related requests. There are multiple things considered. The documentation is important, that discussion with the student and the ODS staff member is important, and the requirements for their specific courses and programs are important.
As far as the health center, it is like your doctor's office away from home. It is an acute care setting with some urgent care features. We work to transition students from parent-guided healthcare to self-guided healthcare. So we want the students to know the medications that they're on and why they're taking them, when to seek medical care, when to take over-the-counter medications, how to make an appointment, and to be comfortable discussing their healthcare with healthcare providers. And with your assistance, we can make this a smooth transition.
Great, thank you. And we do have some questions here in the Q&A box. And so just to kick us off, here's a question here is, my son has ADD and takes Adderall, and when can he get in for an appointment there for med management and getting his prescription there at JMU? Betsy, can you answer this one?
Yes. So we do not do any medication management for ADD or ADHD. And we also do not carry Adderall in our pharmacy. That is considered a scheduled medication or controlled substance. So what I would recommend, and what I do recommend to families, is that they maintain a relationship with their provider that is doing this now, and plan ahead. Get with them to see if they will allow telehealth or telemedicine visits for your student to cover them as far as their check-in period. I know during COVID, there was some allowances for 90-day supplies of Adderall. You might see if that's a possibility, or if there's a possibility that they will prescribe the medication, you can pick it up and then mail it if they do their telehealth. If they are bringing something like Adderall, I would also suggest that they maybe bring a small safe that they can keep in their closet. They don't need to advertise they have it, but it's someplace to keep the Adderall safe.
All right, Paul, this one's for you. If you can tell us a little bit more about the number of campus counseling appointments, and are those numbers per academic year or over the course of all 4 years?
Sure, really great question there. And it's it depends type answer, sort of complicated. So during those initial walk-in appointments where they're meeting with a provider during an intake, part of that is discussing, is this sort of an acute short-term issue, adjusting to college, going through a breakup, loss of a family member, something like that, that might be indicated for short-term treatment? Or is this a concern that might be longer term? So in most cases, we would say that would be, 3 to 6 appointments per year, perhaps. But if a student comes in, their freshman year and then we don't see them again until their junior year, like things like that, wouldn't lead to a student being turned away. So it really is case dependent and sort of difficult to answer, but maybe that's a swing at it.
Thanks, Paul. All right, Betsy, I'm going to ask you this one. Does the health center have a small emergency room? Does it perform x-rays or other basic diagnostics procedures? You're muted, Betsy.
Yep.
Yeah,
sorry, I was just typing the answer in, but yeah, it's a good question. We do have x-ray services. Centera RMH has an x-ray suite in our building. So if a student needs an x-ray, they will perform that, and that will be billed to your insurance, and then you will be balance billed anything that is not covered. As far as diagnostic procedures, we do lab work. We have in-house labs, and we do some minor procedures like suturing and temporary casting, that type of thing.
Thank you. And since I have you, any suggestions on what over-the-counter meds to bring and what not to bring with them?
I think whatever over-the-counter medicines they use now, I would bring a supply of, at least a 30-day supply. We had a parent the other day comment that their student was so well supplied they were providing for their roommate, which is a great thing to do. You just want to make sure they have enough for when they need it, that they carry it. We carry the basic Sudafed, ibuprofen, acetaminophen, cough syrups, nose sprays in the pharmacy, and like Sudafed's $1, so it is very reasonable. But having that initial set of over-the-counter medications that they would normally take now would be a good plan.
Great, thank you. A question that we have here is, do we have a list of recommended therapists in town that we have access to now? Anyone be able to help us out?
Sure, I can jump in there, and I'll actually link here to part of our website that is listed of like helping find a community clinician. Harrisonburg being a smaller town in a rural area, we can't always guarantee that community providers have openings. So I guess part of the encouragement there is that if your student is interested in longer term or off-campus services, to do that sooner rather than later once they arrive at JMU. And additionally, if they try on their own and are unsuccessful, send them into the counseling center. We have case managers and staff that are well-trained and have resources to help them navigate that and also equip them with the skills so that they can manage that in the future in terms of skill development.
Great. All right, next one that we have here is, does my daughter need to sign any legal forms such as the healthcare surrogate, et cetera, if an emergency happens? Betsy?
No, there is no need to sign any legal form, no power of attorney, no medical power of attorney is needed. When a student is seen at the health center, they are asked per visit, can we share this information with anyone? That's a yes, no response. If they say yes, then they have to put in who we can share it with. If they're conscious and they end up in an emergency room, it is up to them to contact you to let you know what's going on. If they want you to talk to the doctor, they will call you. You can speak to the doctor by phone. If they are unconscious, they're not going to come to the health center. They go to the emergency room. Believe me, the staff and the doctors at the emergency room want to find you. So they will notify campus police. Campus police will look up who the emergency contact is for the student, and then they will notify you, and then you can call the hospital and they will provide you information. They want to know where you are. They want to know if you're coming. They want to know what the plan of care should be.
Great. Here's one that hopefully, Brittany, you can help me out with is, my son sees an oral surgeon for some various procedures he has coming up in Lynchburg during the fall and spring semester. Is there a place to keep a car for him so that he can come and go for his appointments?
Thank you. Yeah, and I saw Paul added some information about possible third parties that could support this. Your student can also work directly with parking services to get an exception to the no cars on campus policy by submitting documentation directly to them. So if you have a medical reason or other reason for needing to attend appointments here locally or somewhere else where they need a vehicle, then work with them directly to get that exception processed. And I'll put a link to parking services that Casey can share in the chat.
Great. Thanks, Brittany. And we probably have time for one more. So Betsy, I'm going to come to you on this one. We are from out of state, and if my son needs medical care on campus, how do we pay since the insurance is from out of state? For example, labs, x-rays, et cetera.
So we don't bill insurance. The actual visits are included in their student services fee. So there's no charge, there's no copay. There are nominal fees for lab work and some procedures. We like to have their insurance. So if they get an x-ray, like I said, Centera will send that. We do have a contract with LabCorp. So if they have extensive lab work, they can do that as well. They can use insurance as well. But we also like to have it in case they're referred to an off-campus specialist for some reason. That way we already have the insurance information. It makes that process much smoother. Anytime there is a charge, the student is expected to pay at the time. They can pay with Flex, which is money on their Jack card, a debit card, or a health balance card, or whatever you call it, as long as it has their name on it. And they will pay at the time. If there's something you feel that you can get reimbursed for, they will have a statement on my JMU chart for anything that they've paid for that you can submit for reimbursement or towards your deductible.
Great. Thank you, Betsy. Well, we are all out of time. Thank you for all of your participation and the wonderful questions that you did ask. If you didn't get your questions asked this afternoon, there is some time in the schedule after our next session called Campus Connections, and that has contact information for these offices as well as many others, that both phone and email. And so if you have the time in your day, feel free to reach out via email or phone, and we'd be happy to continue to answer those questions for you. So with that, I hope you have a good rest of the day. Thank you all.